9 o'clock on the dot. You're locked in with the doc on the rock. So, we'll take this thing all the way to the top. We ain't gonna stop, until we drop, or the clock stops. That's at 9:30. dr.sparman, thesparmanclinic.com, www.thesparmanclinic.com, and good morning to you and you wonderful tourists and listeners out there. In Canada, England, I don't care where you are. I heard a guy in Germany call me, last week, saying that he enjoyed the program. So, yes, call your friends, call your neighbors, call everybody, let them know what's happening here. You tune in to Living every 9 o'clock, VOB 92.9 FM, and we'll give you 20 to 30 years of your life, modification of lifestyle. I'm telling you, you'll listen to this stuff, red meat and all that stuff I talk about. You follow these modification patterns and you add years to your life. By the way, I just saw, remember I told you guys about coffee, and I'm getting people to drink coffee, and if you have a heart problem and you got palpitations, just stay away from the caffeine. But studies have shown that this coffee, as a matter of fact, you drink coffee, it decreases your incidence of throat cancer and cancer of the breast, actually. And also, it decreases your memory loss and Alzheimer's disease, and it increases longevity. But yesterday I was looking up some other stuff, and I stumbled on some other things that coffee can do. They say it has a potential, actually, to decrease type 2, actually, diabetes, or the non-communicable disease, diabetics, and so forth. If you drink 1 cup of coffee per day, it says it decrease your incidence of diabetes or type 2 diabetes by 7%. And it's recommended 4 cups per day, man, and you can live longer. That's just by the way. But today we are going to be talking about a sexually transmitted disease. And last week we talked about, and the weeks before we talked about HIV and living with HIV. As a matter of fact, last night I was just walking in the street and I saw this fella, very healthy looking guy, and he says he's living with HIV for 23 years. So out go Magic Johnson, he says. 23, and you wouldn't tell that this guy's got HIV. So we don't have a cure for this stuff, but if you take your medicines and you live a certain way and you healthy, eat healthy and so forth, you can live for a long time with this thing. So today, but everybody think about sexually transmitted disease and they think that it is HIV. But today we're going to inform you, ladies and gentlemen, about all of the things that can cause STD. So tune in. We got live in the studio today. We got David. Morning, David.
Good morning, sir. How are you doing?
David Browne. David Lifestyles. We'll talk about sex and how sex can be still pleasurable. Safe sex and condoms can still be pleasurable. We'll talk about that, and we'll give you guys some gifts and at least about 3 nice extra things to enjoy this wonderful thing called sex, but done in the right way. And this is not for children. You guys, no, adults, you should be reading your book and studying to become the people of tomorrow. When myself and Dennis and David leave this world, we want you guys to take over, so you can't be having sex right now. Yeah, I'm having fun, and I want to say it's a nice Saturday morning. It's a holiday, so guys, be careful, and we love you. And every Saturday morning we're here, half an hour to give you nice, wonderful things and tell you things that normally you don't hear about. But sexually transmitted disease, it's not only HIV. You got bacteria. There are viruses, there are protozoans, there are fungus, and there are parasites that can be transmitted sexually. Let's go first of all, talk about chlamydia, caused by a bacteria. This is one that 80% of females don't even know they have it. And it's sexually, when you say sexually transmitted, it means by sexual intercourse or body exchange. And don't think it's only by vaginal penetration or anal penetration. It's also from oral activity. You think you can have sexually transmitted disease in your mouth? Yes, you can. I say, you check the literature, you check the internet. So chlamydia, how about clap? You ever had a clap? The guys tell you, you ain't graduate yet until you get the clap, man. You're not a man until... Listen, stop that. Gonorrhea, that's what they call it. They call it the clap. Gonorrhea can cause some serious stuff. That's not a bacteria. Bacteria type of or bacterial type of infection, sexually transmitted. There's another one called syphilis. A lot of people die from this thing before. You would have read the history about this stuff. But anyway, with all kind of madness and mental illness because they weren't treated. But now there's treatment for it. But syphilis also. You got an ulcer in your genital area and you don't know where it came from. Changroid, they call it. God, man, it's just this ulcerating thing going on there and they're moving. That's sexually transmitted also. Let's move on to some of the viruses. Genital herpes, no cure. You get stressed out and you see these vesicles appearing in your mouth or in your lips actually. It's on the rim actually, your lips and it normally occurs in the same spot. You see a guy and every time you see him, every now and then, and also coming up in one area all the time. Be careful, you may be dealing with herpes. He could tell you, oh, it's some type of cold sore. Oh, man, I had fever last night. No. You what, that spot? It comes back in the same spot. Same thing with the genitalia, actually. You can have the sexually transmitted type 2 and the type 1, but herpes, there's no cure. All we do is try to suppress the stuff. You get these things, guys, for the rest of your life. You have it. You 17, let's say you're 21, 22. What do? You get married, you have to tell your... Oh, well, baby, you can get married next year, but by the way, I got something to tell you over dinner. You got herpes, so... All right, I'm sorry, bye-bye, I'll see you later. So, yes, these are things that can marry and affect your life significantly. So, how about genital warts? You got a small dot somewhere, you see the guy with some type of dot somewhere in his genital area, or in his, at the back or so, and it looks like cauliflower. It looks like as a matter of fact, it's small and it looks like broccoli, but it's black. And the guy says, oh, it's a mole, I've been born with that. No! It's called papilloma, and it's transmitted. As a matter of fact, this thing can infect females and cause cervical cancer. We'll talk more about that. And those are viruses. Hepatitis B also and D. You can get hepatitis, that stuff that destroy your liver and cause cancer of the liver. Yes, you can get it. There is the HIV virus. Let's go to some of the protozoan. Trichomonas. People don't talk about this one. Ladies, you have a very foul, pungent smelling discharge. Trichomonas. Oh, you gotta know, it smells a lot like fish. That's sexually transmitted, and sometimes you don't even know you have this stuff, but you got the odor that you didn't have before. Please check it out. Let's go on to some of the... this is stuff here. How about a jock itch? You had sex with a partner, but you find you're itching all the time. What's going on? Jock itch. Fungus. Yes. So that's another one. So that itching also sexually transmitted. How about yeast infection? We thought only females get that. No. Dr. Sparman said it this morning. Today's what? The 21st? Yeah, the 21st. Yes, I said that. Yeast, men can get it too. And a lot of times what happens, redness in the prepuce or the area, the foreskin actually, you'll have a little bit of redness and itching. You find you're having a lot of that, probably you get yeast infection from your partner. And there's just cream and a little bit of tablet or so can take care of that. But it's happened before. It was not classed as sexually transmitted, but now it is. And then we move on to things like, how about the parasites? The pubic lice. Yes, they hang out in the hairs there, man. You can't see it. You're having sex at night or you're having sex in the daytime. You don't see these things. They're small. They're hanging out in the hair, but they would itch you. They're parasites. Sexually transmitted. And now, scabies. Everybody know about scabies, right? Are we talking about... You know, skin to skin. You're gonna have sex with this gentleman, and he says, well, listen, baby, I don't get a good erection if I have a condom on, and I don't like it, and I like skin to skin. If you love me, you know, you could just know. You could be skin to death. Cause just one mistake you make, and you can have problems. It's all mental, and that is why David is gonna tell us down in the program, we're halfway down there, he's gonna tell us about how you can still enjoy sex, safe sex, and condom, and so forth, and still have fun, because it's all about living. You see this oral stuff? You guys, you have you meet a young lady today or vice versa, and then you find 3 days after you can't swallow properly. You could be infected with some type of infection, whether it's gonorrhea or chlamydia. These things can hang on to your throat and cause serious problems. So it's not only genitalia, it's also in the mouth. Now, let's think about some of the symptoms that you have. For instance, chancroid you see an ulcer, that ain't going away in the genital area. That's chancroid right there. Chlamydia, I said earlier, 80% of females and 50% of men wouldn't know they have this stuff. But sometimes you can have a discharge if you're symptomatic. So if you find that you have a discharge, normally it doesn't happen the same night, or the next day. 2-3 days down the road, you start to have some symptoms. Now let's go to gonorrhea, the guy they call clap. This is the bad guy. And normally, gonorrhea and chlamydia coexist. Most times when you have one of these sexually transmitted diseases, you got another, they say, the other one actually. And doctors normally, when you have gonorrhea, they treat you for chlamydia too, because the guys like buddies. They like to hang out together. 50% of the females actually wouldn't even know that they have gonorrhea. And then we talk about syphilis. Syphilis is basically, you can get that. It's bacterial also, and there's treatment for that. And a lot of times you can get a rash, headaches, and so forth. A few days down the road, you start to feel sick after sex. A few days down the road, you know that something is happening, especially if you had unprotected sex. Let's go to some viruses, like herpes, the one that I told you can't cure. Normally when you're stressed out, or sometimes it just spontaneously just comes out in vesicles, in the genitalia, and then it'll go away after about a few, sometimes some medicines can shorten the time the vesicles are there, but you can get infected even if there are no vesicles around. So you have these sores or ulcers that are flaking and crusting on your lips or in the genitalia. Herpes is there, man, and you can transmit it to your partner. There's just treatment for it, but there's no cure. Genital warts, we talked about that earlier with the cauliflower type of appearance of black warts that are not moles. They're normally raised. And don't forget, ladies, sexually it can be transmitted and give you cervical cancer. So you guys with the wart, look at it and say, hey guy, what's that? Did you have it checked out? That type of stuff, Hepatitis. You can get hepatitis B or D, that same stuff that causes cancer of the liver and liver damage. You can get it from sexually transmitted disease. And we talk about HIV, which I wouldn't mention, but you guys know about that, how you can get that, and that one is, there's no cure for that neither. We go on to some of the the protozoans actually. Trichomonas, remember the fishy smelling, frothy type of green discharge, and as a matter of fact, it's foul smelling. You find you have that. Mostly in female, men have it. They don't have those symptoms. But a female, normally it presents in that type of pungent type of smell and so forth. You just get yourself checked out. There are tests you can do to find out what's going on. And then we talk about a yeast infection, which can be transmitted to males and female. And this just screams and a little bit suppositories and so forth. Good for that for females, or tablets for males. The jock itch, we talk about that. So you itching, man, right? You itching, you scratching your genitalia and the hair area. You know something is happening. It wasn't happening like that last week. You had some unprotected sex and it started to happen, guys. You got some type of jock itch. How about the pubic lice and the parasites and the scabies? You see what we're talking about? So sexually transmitted disease, a lot of stuff can get you. If one does not, another one will. And then they coexist. David, how are you doing?
I'm good, sir. How are you doing?
Well, thanks for coming. We want the people to understand that, well, there's treatment for this stuff. But you have to consult your doctor. There's no home remedy and herbal stuff and telling yourself you're going to drink this or drink that. No, you go to the doctor, get tested, and get treated. But to prevent all this stuff, lifestyles. Tell us a little bit lifestyles and condoms and even how you can still have sex, safe sex. Again, I said, not for kids, adults. Having safe sex and still enjoy it.
Lifestyles is one of the top 10 brands in the world. And Brydon's, we recently launched the brand this year, and it consists of a range of condoms as well as vibrating rings and lubricants and massage oils. So we're taking safe sex a step further.
Oh wow.
So you're making it fun.
So not condoms alone. Tell us a little about the vibrating ring. What is that?
The vibrating ring is used in conjunction with the condom. And it gives both partners increased sexual pleasure.
I understand. Go ahead.
along with the use of the ring, we have the 2-in-1 massage oil. So it's a massage oil you can probably give your partner, or your partner give you, or both of you get it, a massage, and then you use it as a lubricating gel. Because most people, when they use a condom, they find it gets dry or uncomfortable. The Lifestyle lubricants add that extra moisture and pleasure to your experience.
Good, you see, sex is great for adults. It's just about how, when, where, all of those qualifications and so forth. Guys, 434-1771, 434-1791, 434-1790. You can call and we can give you three. You just call and give us your name and you get some of these gifts. What would we call it?
Yeah.
Gifts.
We're going to give you a Lifestyles package.
Yeah, so you can enjoy sex and still have fun. And you have to, those are the very, the ones they call skin, the very thin ones, right?
Yeah, we have Lifestyle Skin. It's polyisoprene, and it's a non-latex condom. And the key to this brand is the fact that it is extremely thin, so you feel as though you're wearing nothing.
Wow, and what about the durability? You don't break and stuff like that.
It does not break. It's extremely durable. But the key to condoms and them not breaking is there's a rule. You pinch, you leave an inch, and you roll.
But you don't do like the lady last week. We had Tamara, who was a night worker, and she says that the guys used to pinch the condom so that they can get some stuff outside there. Like, so we got to be careful of that pinching.
No,
right now.
It's not to pinch. It's not to pinch to burst it. It's to pinch to leave an inch.
Oh, I got you.
So that we have a reservoir for
the. I got ejaculate and so forth.
That's right.
So in other words, if you put this is a special way to put it on.
That's right.
And if you put it on properly, you can have sex. This thing it wouldn't.
You will
What's the probability? Probability.
It's the probability of a condom bursting is probably 1 in 95%. Okay. With every batch of condoms that are made, they are water tested. If one condom, for whatever reason, has a problem, the entire batch.
So let's get that clear. Out of let's say 100 condoms, what's the possibility that one would break? Is even less than 1%.
It's even less than 1%.
Just want to get it clear. Well, you stop at the store and you pick up condoms. Some people are looking you strange, and like if something's up, what's the story about that? Why can't a man just walk into a store? Listen, I walk into the gas station and ask for a couple of condoms, and
the silence.
The silence.
We need to get past that mentality. We need to make this thing fun, safe, and make you comfortable when you walk into a store. My belief is that condoms should not be behind the cash register. It should be in front where you pick up what you want and you go.
Yes, condomized. Dennis, we have any callers there right now?
Well, if lines are up.
Oh, let me take just one. Good morning.
Good morning.
Yes, morning.
I have a question for the doc.
Yeah, please.
I've been experiencing a green discharge.
Okay.
A green smelly discharge.
Oh boy. How long you had it?
I've been having it like a week now.
Oh, wow. All right, good. So you can hang up and I'll tell you. You see, we talk about trichomonas. You see that? People have this stuff. And guys, let me tell you right now, we didn't take no call-ins. The phones were off the hook right there. Then it's just demonstrated to me. But listen to me. People want to know about this stuff. But that green discharge could be trichomonas. Trichomonas, frothy, smelly, and you may have it 1 week or 3 to 5 days after sexual intercourse. It's simply treated. But this thing here can scar that along with chlamydia can scar the fallopian tube that goes from the uterus to the ovaries, and that scarring, abscess formation, well, as a matter of fact, you won't be able to make children, infertile, and a lot of times it can cause a lot of death also, an abscess formation. So this thing here, so this young lady, whoever you are, thanks for calling and being so brave. You go to see a doctor, they do some swabs and some tests, and they can treat you, and before you know it, it's over. But when these things happen, you have to do it very early. Now, this program is we got so many things to talk about that I'm going to hold this off for next time. But I want to thank you guys for all listening. Thanks for the caller for calling in there. And guys, for you guys who try to call us and couldn't get to us, it's okay. You catch me another time. David, thank you for coming.